Does your child play sports? Do they exert themselves in activities like goalkeeping, wicket keeping, or are they into gymnastics? Are they getting pain in the hip joint? Or you, for that matter, started getting pain in the hip joint around 40 years of age and you are having restriction in movement of the hip joint. So, you may be a candidate for a hip arthroscopy. So guys, what are these problems in your hip joint? So typically these problems have an onset at adolescence, especially in individuals who are athletic, who are into gymnastics, kickboxing, who are into activities where repeated squats are required, where extremes of movement of the hip are required. So essentially what happens is in the growing age, the hip bone deforms and it can lead to abnormal anatomy of the hip which can cause pain later on in your age. So if addressed at an early age, these issues can give a lifelong pain-free movement of the hip, but if unaddressed, then these issues are known as a silent killer of the hip joint. So what are we talking about? We are talking about femoroacetabular impingement. So guys, what essentially happens is in children, especially between the age group of 10 to 16, the bones are growing. And in that age group, with increased awareness, where people are now more into sports, into recreational activities, extracurricular activities, there is focus on gymnastics, sports, certain activities where extremes of movement of the hip are forced. For example, in wicket keeping, where there is repeated getting up and down, or in goalkeeping in soccer. So, in these scenarios, the hip undergoes extremes of movement. There is more contact between the ball and the socket. So to adapt for this in a growing age group, the hip starts deforming. This can lead to an abnormal change in the shape of the ball and socket joint, wherein the ball gets deformed, which is known as a pistol grip deformity, or it becomes a little misshapen. So that leads to increased contact between the ball and the socket, and it can lead to tears of the surrounding tissue of the hip joint, which is known as the labrum. So typically it can cause pain at extremes of movement of the hip joint. It can cause restriction in movement, and you will not be able to be at 100% when you're playing sports. Now, what we need to understand is these issues will never cause unbearable pain. That is why the term for this problem, or femoroacetabular impingement, is a silent killer of the hip joint. So typically individuals develop this problem when they are in the age group of 12 to 16. It is quite asymptomatic. Yes, the activity level will go down. Probably you'll focus more on studies after that. And that level of athletic performance will not be there. With regular activities like walking, studies, and everything, you'll not have any issue. And as the age progresses, once people reach the middle age, that is where the problem rears its ugly head. And it is at that point of time, it becomes a bit late to address this. So as a result of this abnormal deformity, or the cam deformity of the femoral head, which can lead to labral tears, over a period of time, it can lead to wear and tear of the cartilage, and it can lead to early onset hip arthritis. So can you imagine people undergoing a hip replacement surgery at the age of 35 to 40? And it is very common in Western population, but an increase in sports in India, it is becoming common in India also. So can we prevent this? We can, yes, we can prevent the development of arthritis in the hip joint. We can prevent early hip replacement by addressing this problem early when the individual is between the age of 12 to 16, and that is where hip arthroscopy comes in, where the problem is at an early stage, symptoms are less, we address it early so that this does not progress further. Essentially what is done is through a small keyhole surgery or an arthroscopy. So essentially 3 cuts about the size of your fingernails are taken around the hip joint. We insert our camera and instruments inside, and we trim the bone and shape it to the correct shape. In addition to that, if any tears of the labrum are there, we repair them. So this gives a good function. It's a small surgery. Typically, people can be discharged the next day of the procedure. For the first 6 weeks, if labral repair is done, then weight bearing is not allowed. If there's no labral repair, then immediate weight bearing also can be started. And typically, by around 3 to 4 months, individuals can resume sports. When it comes to normal walking, if it's just a trimming of the bone, by around 4 weeks, people can start normal walking, and they can start gym, they can start swimming, cycling, and all these activities. But yeah, athletics generally after 4 months. So hip surgery or a hip arthroscopy is a very, very safe option. It's a minimally invasive option which is there to prevent the development of arthritis in your hip joint. Now only thing it needs is more attention at your side towards your hip joint, noticing these symptoms, that if an adolescent is there in your home or household, then is there a nagging pain in the hip which is not severe but is restricting him from playing to the full potential. If there is some restriction of movement of the hip joint, if addressed at an early age, it can lead to good resolution of symptoms and ensure that the individual is able to achieve athletic excellence also. Thank you. So if you like our channel, or if you know somebody who is having hip related issues, especially in a younger age group, it's very important because hip arthroscopy doesn't have a rule above the age of 40 years. So in a younger age group, if somebody is having issues, if they are having pain in the hip and restriction on movement, then you can share it with them and it may be beneficial to them. All right. Thanks for watching.